All right, so welcome. I'm so glad you're
Hello.
hello. So today we're going to talk about premenstrual syndrome, and I think this one is one that I always really want to talk about because so many people are affected, and it affects people's lives so profoundly. You know, when you really think about it, it's about a quarter of a person's life if they're affected by premenstrual syndrome, and that's if they only have symptoms for a week, a month. Some people have symptoms a full 2 weeks for the whole second half of their cycle. And there's so much we can do about premenstrual syndrome. I really think of it as being something that really is an indicator that something deeper is happening. You know, very often, you know, hormonally, nutritionally, dietarily, in terms of the balancing of hormones and hormone production. So in terms of just kind of like running through, you know, what is PMS when we're talking about it, it gets kind of thrown around a lot. And most of the time when people talk about PMS, they're talking about like the mood changes, the irritability, the depression, the weepiness, difficulty sleeping. But really, I want to just sort of point out that PMS has a big range of symptoms. You know, both what I just mentioned in terms of like the mood changes, difficulty sleeping. Bowel changes are a big part of it. Some people get really constipated and other people get have kind of looser stools. And for some people, it's a real big problem, actually. Another thing to note is that certain people will have more reflux at certain parts, like gastrointestinal reflux. Some people get a bad reflux premenstrually as well. And that's partially because progesterone relaxes that lower esophageal sphincter, so it can just happen more easily. Kind of along with that, people have a lot of bloating, headaches, that sometimes people even have like migraine headaches. Acne is something that comes up for people premenstrually. And then another thing that often goes kind of, it ends up under the category of irritability and mood changes, but is actually its own thing, is low blood sugar and excessive hunger. So very often when people are in that last phase of their menstrual cycle, it will be they'll more have a stronger tendency towards low blood sugar. And there's a bunch of different reasons for that, but just kind of knowing that that's the tendency. And so that low blood sugar can make people feel really spacey, angry, tired, frustrated. And so what I really find is that focus on eating lots of protein and lots of healthy fats in that last week or two is really helpful. Partially, this becomes extra challenging because very often people will feel a craving for sugar in that last week or two, and that's going to make that whole low blood sugar thing a whole lot harder because they're going to be
Yeah, because that's it. Exactly. The craving for the sugars and stuff.
Yeah.
Right.
So it can be
But will the protein balance that off? Like if you eat more protein and fats, then you might not have a craving for the sugar?
Totally. Yeah. You won't have as much of a craving, and also your drops won't be as much. So definitely. So that is, you know, one of the best things, and healthy fats, same thing, for, you know, really kind of helping to regulate blood sugar and prevent the cravings. And then a lot of people will experience body pain or joint pain, and definitely sleep changes. For some people, they feel like they want to sleep a long time, and for other people, they have a lot of trouble sleeping. So that's PMS, kind of the whole picture of it. But then we want to look at, there's some nuances in terms of different types of PMS, right? So there's different people kind of categorize PMS in different ways, whether it's more of anxiety, more of, depression, more of breast tenderness kind of thing, heavy periods. What I actually tend to the way I classify PMS is I'm listening to people is really about what the cause is. So there's I think of there being three main causes of PMS. And the first one that is probably the reason I kind of put it on here is that it's, I guess actually high estrogen and insufficient progesterone are really tied for the top. So I started with high estrogen. High estrogen is when there can be estrogen. So there's these names that you probably have heard around called estrogen dominance, which is where estrogen is high relative to progesterone. Whenever there's a relative difference between estrogen and progesterone, and that ratio is off, we get all kinds of symptoms, both heavy periods as well as PMS. And that can be because the estrogen is high or because the progesterone is low, or both. So if they're normally here, you bring up the estrogen and now that ratio is off. And if the progesterone is low, they're off. But very often it's kind of both at the same time. And that can be, we'll talk about kind of why that can happen. But the way we can sort of identify high estrogen PMS is really about breast tenderness, some mood changes, kind of like more of like a weepiness and flushing, water retention. So people who talk about feeling really puffy or putting on a lot of weight right before their period, it's often they have quite a lot of estrogen. And that breast tenderness can get to be very, very severe, so that people have difficulty, putting on a shirt or just sort of doing their normal activities because of the pain. Sometimes people have the fibrocystic changes in their breast tissue, which is where it feels kind of lumpy, and that's also can be painful as well. And really, whenever the estrogen and progesterone are out of balance, we see heavy periods. And what I tend to look for is that, so basically the best way to think about that is that inside the uterus, the estrogen is like the bricks or the building material, and the progesterone is like the mortar between the bricks. And so if there's not enough progesterone to estrogens, if you've got a lot of bricks and not enough mortar to stick them together, it falls out really easily. So it's kind of like, if things are going well, you have kind of like a layer by layer sloughing that happens, versus like a just heavy for day 1, day 2 and the big thing, when estrogen is high, a lot of times we see blood clots, a lot of pain with periods, and really heavy periods. So that's kind of the thing. If somebody comes in and says that they have sore breasts and they have heavy periods, I'm thinking about how can we work with their estrogen? How can we decrease their estrogen? And so kind of how does estrogen get high? There's a bunch of different reasons. One of the big ones is, constipation or not having enough fiber in a person's diet, because basically your body uses your bowels to get rid of excess estrogen. So, a lot of times I've actually treated a lot of PMS by just treating constipation, and it works. So the other thing to think about is, alcohol intake does increase estrogen levels. That's part of why it's a risk factor for breast cancer. So something, they say that, you can do like between 1 and 2 drinks a week and it won't really profoundly affect estrogen levels, but more than that does tend to increase estrogen levels. During perimenopause, people do have a lot of ups and downs of their estrogens. And I also see this, the other time I see this really big is after people finish breastfeeding and their period is coming back, they'll get these really highs of estrogens and then lows and just kind of up and down quite a bit. And then xenoestrogens, which we'll come back to later, are really, the sources of estrogens in our environment. And right now there are so many, partially because plastic is the big source of xenoestrogens, and plastic is everywhere in everything. Some of the ways that you can really, avoid those xenoestrogens are by, checking your skincare products like we talked about, but also avoiding drinking out of plastic bottles, and especially if you do have something in a plastic container, to make sure you're not heating anything in a plastic container, making sure it's BPA free, ideally using mostly glass and metal containers for food, so that you're not sort of getting those plastics.
So even if it's BPA free, you probably shouldn't be using plastics. It would be the best.
BPA is one they did the most research on. And also there's other things in plastics that are estrogenic. So BPA seems to be the worst one potentially, but it's definitely, there are other things in plastic. So
all right.
Because it's kind of like they did so much work to get BPA out of everything, and it's like,
right.
So it's a lot better, definitely it's a major step up, but anytime you can do glass or metal, it's even better.
Now here's just a thought about like an increase in estrogen. Or kids developing really early? Like it seems to me that the girls are developing earlier and earlier and earlier. Yeah. I mean, could it be also, I start thinking of like all the plastic toys they have in the tub, and would that have anything to do, or just drinking out of the plastic bottles? I know also our foods probably contain stuff, but just your thoughts on that.
Oh, that's a really big question in the research right now, and that is what a lot of it's coming back around to is about the estrogens in the environment, and like everything from like even in the water they find levels of estrogen, and then all the plastics exposures that are happening, and then skincare products, all kinds of chemicals that are really estrogenic, and so they do these studies where they do a couple of things. They look at samples from children, but they also look at breast milk samples to see like how much of these compounds are in breast milk, and it's like there's a lot, and so it is absolutely true that girls especially are developing much younger, and the average age of menarche has reduced by like 4 years over the last 50 years, I think. I mean, it's big, like you have a lot of
right
that are 8 and 9 years old getting their period.
I know, it's crazy.
Yeah, it's very, very different. And there's so many different like theories out there for it, but I think that the one that I really ascribe to the most is that it has to do with these estrogens in the environment, because it just makes the most sense to me. So the and flame retardants are another thing that have a lot of estrogenic effects. And these days, like kids' pajamas are all treated with flame retardants, not to mention like mattresses and everything else. But, I think about like, even just like how quickly kids go through pajamas because they're, growing so fast. And it's like, right. Oh, like that's, basically probably they just get to the point where the flame retardant is like reduced in their pajamas, and then they get a new pair of pajamas, so.
Okay, yeah.
Some that don't have those flame retardants in them, but I think it's like a standard to have them, to have the flame retardants in the pajamas especially. So that is kind of like the, and also the other thing too is like people can get high estrogen because of vitamin deficiencies. So especially like B12, folate, and magnesium. And magnesium, we'll kind of swing back around to magnesium, but magnesium deficiency is actually really widespread. There's a lot of people who are deficient in magnesium, and it really does contribute to PMS. And also the way that people get deficient in magnesium is both through high stress. We lose a little extra magnesium when we're under stress, and we also lose magnesium when we eat simple carbohydrates. So our body just sort of like lets go of some magnesium every time we eat a simple carbohydrate. So we have a lot of both of those things going on in our current, environment. So hence, that might be a major contributing factor as well. The next kind of PMS is really not having enough progesterone, and so there, we see this a lot, pretty much just as much as like a high estrogen. And sometimes it's really hard to tell whether it is high estrogen or low progesterone, because what we're really seeing is the symptoms of that ratio. But when I look at the people with low progesterone, a lot of times they experience a lot more anxiety right before their period rather than more of the depression. That is not 100% true. Like, like there's definitely exceptions to that by a long shot. And they can have like, more of like much more of difficulty sleeping is another main complaint. People with the low progesterone don't tend to have as much of like the breast tenderness, and like not so much of like the fleshiness or the, and sometimes not as much of the water retention, but sometimes they can have just as much because that ratio is a little off there. One of the big thing about low progesterone, and this is why this is also so common, is that so our body basically, there's this pathway that has on it, pregnenolone, and then make progesterone, and then you make cortisol. And what your body will do is preferentially make cortisol because that's really a survival mechanism. We need cortisol for survival. So it'll they call it the progesterone steal or the pregnenolone steal, to basically shunt it all towards cortisol and make that instead of making progesterone, instead of keeping progesterone. And so what will happen is people will basically, I think of it as like a hole in the bucket, it's just all of it's going out towards cortisol, and then there's no more progesterone left. And then they end up with these, really heavy periods, more of like a blah kind of feeling, because both estrogen and progesterone do affect production of serotonin and dopamine. So that's part of how we get to these levels of depression and anxiety and things like that as well. But progesterone itself is very calming. And so that's part of why when you have really low progesterone, your body, will feel anxious. So also the other thing that happens that kind of ends up creating a little bit of a snowball effect is that when your cortisol is high, it actually can block the progesterone receptor. So even though the progesterone that you do have doesn't really get to be active. So it doesn't get to, the way a hormone is active is that there's always a little receptor, and then the hormone goes and finds that receptor, links into it, and then that kind of like stimulates this whole cascade of things that happen after that hormone hits the receptor. And so if you have, cortisol here blocking this receptor, now you might have some progesterone here, but it just can't make it into that receptor. So it's even more of a symptom of low progesterone. So that's really a double whammy that happens when you're caffeine intake is another one that can contribute to that because of the way that it affects cortisol and everything. And then the other thing that I've been seeing more and more often is people are doing this intermittent fasting thing. Some people say that they're experience feeling really great on it. When I mention intermittent fasting is when people sort of say that they they go like, 16 hours or 18 hours without eating. So they stop eating after dinner and then they don't eat again until like lunchtime or later the following day. And some people, feel really great on it. I find that especially for people, who are menstruating, it can have some longer term, after the first month, often people feel great. And then after that, they can feel not as great, partially because what happens is your body has to use cortisol to get you through the morning, to keep your blood sugar up during the morning. And then all of a sudden it's like, now you're just like tearing through your cortisol, or some people, they're feeling more anxious, or sometimes they're feeling, just like more stressed. That I find that people who are doing a lot of intermittent fasting, I see them gritting their teeth more, like having a lot more of these like, jaw symptoms and teeth grinding and everything. And long term, I actually have now a good number of people who I've seen it sort of affect their menstrual cycle. So it's not something I highly recommend, the intermittent fasting. I think that it's great. The best part about it, I think the most effective part of it is like not snacking after dinner. That's a really pretty good thing to avoid doing, for a lot of reasons, both because of digestively it's great, but also because it tends to be the time of the day that none of us make our best food choices. So yeah, that's how that works. So yeah, that's low progesterone. And also the other thing too that can cause low progesterone is low thyroid function, or lack of ovulation. So again, kind of like getting towards perimenopause, a lot of people, don't ovulate, and then it's really ovulation. And when I say ovulation, that's the release of the egg. That if they don't ovulate, then they don't produce progesterone, because progesterone is really coming from the little sac that the egg was in before it was released. It turns into this corpus luteum and it makes progesterone. And so if the egg is not released, it never does that process of making progesterone. So anybody with anovulatory cycles, including people, who are perimenopausal, people with PCOS, which is polycystic ovarian syndrome, can have not enough progesterone because they're not releasing the egg. And then low estrogen is one that we see. Actually, people often assume that only happens for people like closer to menopause, but I've seen it in young women as well. It does seem to be worse after people have give birth. And so often, we see like kind of an excessive hunger, vaginal dryness. That's probably that's the big thing I look for, that kind of clues me into that there might be not enough estrogen, or and then kind of pain with any kind of vaginal penetration, weak orgasms, depression, frequent feelings of overwhelm. So this is again nuanced, like that can show up in a high estrogen situation. It can show up in a low progesterone, but I do sort of like think about it when I hear people just kind of like, name different situations and talk about overwhelm in each of those situations. It's kind of, having low estrogen is because of the way that it affects serotonin and dopamine. It does seem to be associated with that. Not always, but sometimes. Yeah. Okay.
Now you're going by symptoms to determine whether or not you have low estrogen, et cetera. Are there any blood tests that could be done? Like if you have symptoms that are sort of vague or they go into both categories, can you do testing?
Yeah, there's a couple different things I do. Sometimes I send people to the lab on day 21 of their cycle, and the benefit of that is that it's like we can go to Quest Lab, and it's like, or any lab, the hospital labs, and it's covered by their insurance. The drawback of that is that it's always like, I always say it's like looking in a bathroom mirror, because we're kind of basically seeing an outline, but we're not quite sure what we're seeing. Would it be different if we tested on day 22 versus day 19? And so it can be a little hard to look at. When people are really having quite a lot of menstrual or premenstrual syndrome symptoms, I've been lately using this thing. It's called Mira Fertility Tracker, and what it is it allows people to actually get their estrogen and progesterone numbers every day. So we can look at like this month and see the full cycle, but then also what that allows us to do is then we do a treatment, and then we get to look at another cycle. And it is, a lot of times when we do the more extensive hormone testing, it's usually send out testing, because we get a little bit more information from doing like salivary urinary testing like every day. And so that testing, for like sending it out to Genova, it's like, I think it's like 160, 170, but for Mira, you get 2 months of tracking for that same amount. So I've been kind of excited about Mira lately. It's a great way to just get all of that information. But kind of to start with, there's plenty of people that I just go off of like we look at symptoms, and that kind of gives us the best picture. And then we do a test at regular lab at around day 21 of their cycle, get a good kind of sense about that ratio between estrogen and progesterone. And then we kind of go from there. So yeah, there's lots of ways to do that. And the other thing that happens a lot with people with low estrogen is that they have more of like the hot flashes and night sweats before their period. So there's a lot of people, I've seen people even in their 30s then that are having hot flashes before their period. And then some of the places that I see low estrogen are, anybody who has any kind of pituitary problem, which is like, there's a lot of different issues there. But sometimes after breastfeeding or during or after breastfeeding, especially people who are training really hard, like doing a lot of excessive exercise, and they're just doing a training program, or if they're engaged in like an eating disorder type of excessive exercise as well. And sometimes if people have really low body fat percentage, that also the estrogen can be quite low. And then gluten intolerance is also another one that's a major factor in low estrogen levels. So yeah, that's a good. So those are all the kind of the major categories. Any questions about that or anything? No, okay. So treatments. Where do we go for treatment? First, I always like to start with foods because foods are a great place to start. The brassica vegetables are really good for helping to metabolize estrogens. So, and brassica vegetables, when I say that, I mean broccoli, cauliflower, Brussels sprouts, cabbage, collard greens. What they do is they actually contain something called diindole methane, which is DIM, which is also available in supplements, that supports that liver pathway that breaks down the estrogens. And I like also they have lots of fiber, so they're not just supporting that liver pathway, they're actually supporting the getting rid of extra estrogen. So really, prunes are really good also. They actually very specifically reduce the 16 alpha hydroxyestrone, which is one of the more potent estrogens that's also associated with risk of breast and endometrial cancer. So just 2 prunes a day is really, really helpful for sort of if a person has either a high estrogen or a low progesterone kind of a picture. And high fiber foods are really, really an excellent way to modulate estrogens. Sarah Gottfried, who is really great. You'll see in the resource section, there's a book by her that I do like. It's a great kind of resource about women's hormones. She actually recommends 35 to 45 grams of fiber a day, which is a pretty big amount. And basically you can't really get there without taking a fiber supplement. And I think fiber supplements are great. Like a psyllium husk is a really good one. You can get at a health food store, the unflavored kind. You can get the Metamucil that has like the orange flavor, but it also has like aspartame in it. So much better to with unflavored, and you can add it to juice if it's gross. And also the flax seeds are really excellent as a source of fiber, but they also have lignans in them. So for people especially people with the low estrogen symptoms or people who are perimenopausal, I love those ground flax seeds to cover all of those bases for hormonal balance. So yeah, those are some of the good foods. And then later, as we kind of go through this, we'll talk about seed cycling is the other thing I do with food that's for premenstrual syndrome. And then any question about those foods or anything?
Just about how much flax seeds should you take a day?
About 2 tablespoons is a good therapeutic dose. Yeah. And I always tell people want to work up to that. So like kind of starting with half a tablespoon and then, 3 days later, another half. So it's a full tablespoon, 3 days later, 1.5. And that's partially because you're actually helping your gut microbiome make that shift. And so if you introduce it all at once, you'll probably get pretty gassy and you might have digestive upset too. So yeah, the herbs that I use, Chase tree berry or Vitex is my, I always tease that it's, if I had to take, 2 herbs with me or 3 herbs with me, desert island, especially one that had other people on it, I would definitely take Vitex, because Vitex is just a really fantastic, it's a really, they call it amphoteric. So amphoteric means that it just is has a balancing effect, and partially, the mechanism of Vitex is not super well understood, but one of the ways that it seems to work is by by kind of pushing down prolactin, which is a hormone that, you know, comes up when you're breastfeeding, which is why people don't menstruate while they're breastfeeding. And so it kind of like pushes this down a little bit, which actually helps people improve their dopamine and serotonin levels, but also increases their especially progesterone levels. It sort of has a selective support for progesterone. So really, I've seen so many cases of irregular periods, severe premenstrual syndrome, breast pain, that have gotten better with Vitex. I've had like 1 or 2 people over the years that have had a little bit of worsening acne with it, but other than that, I don't see anybody having any major side effects or anything. There is a Celebration Herbals makes a tea that's great. That's just a chastry berry tea. But then also another great way to get a chastry berry tea is you can actually go to the bulk section of Fiddleheads and make yourself equal parts chastry berry Vitex, which is, so chastry berry Vitex are the same thing. It's 2 names for the same thing. Lemon balm and chamomile tea. That's a really great combo for a nice premenstrual tea. So, and something that you would be good to drink throughout the month, you know, not just when you're premenstrual, but it still works, you know, when you actually, you know, while you're having symptoms. But and then chamomile tea is a great one, you know, really easy to get. And it's been really good. There's a study about it for premenstrual anxiety, really fantastic. And also for menstrual people who have menstrual cramps, it's a really great go-to, you know, just especially if you're drinking it kind of throughout the month, it's really excellent for helping with menstrual cramps. It does even work though, like in the moment when you're having them. And then burdock and dandelion are really great herbs for reducing estrogen. So when people have like more of the breast tenderness, more of that weepy or fleshy kind of feeling, and that water retention, burdock and dandelion are totally my go-tos there. And there's actually this really good combination called Dandy Blend that I like a lot. It's a powder that tastes like coffee, and you can have it like iced or hot, and it's really delicious, and it's a great way to get some burdock and dandelion. And also I've used it really effectively for some people who have like premenstrual headaches as well. The migraines I find are often more, we need to work with progesterone, but regular like headaches, you know, just sort of like tension type headaches that people get premenstrually really respond well to the burdock and dandelion. So that's a good little formula there, that good Dandy Blend. And you can get Dandy Blend like online or any health food store. It's usually right in like the coffee and tea section. Yeah, so those are my go-tos. There's a lot of herbs I use for premenstrual syndrome, but those are kind of my like top 3 that also they're of the things out there, they have like a lower interactions with other medications, because I always have to be careful about that too. So nutrients, we always want to think about. B6 is really good. So here's my caveat for this, is that we have to be careful because a lot of the over-the-counter premenstrual syndrome formulas have a bunch of B6 in them, like really high levels. And I've had at least 4 or 5 cases of probably a lot more than that, but I can think of just in the last few years of people who have been taking an over-the-counter premenstrual supplement and have developed nerve symptoms from having too much B6. And so that what that looks like when you get too much B6 is often people feel like a numbness and tingling in their hands and feet. And sometimes that nerve damage can be irreversible. Most of the time, I've never seen it be irreversible, but because usually people kind of come in but I've read in the literature that it can be irreversible. So we have to be a little careful about the high dose B6 sometimes. But it is really good for helping with breast tenderness and sugar cravings and fluid retention. So it's a really good one. And the in terms of using foods, nutritional yeast and tempeh and Brussels sprouts and sunflower seeds and beans are all really high in B6. The highest on that list is the nutritional yeast. I think they.
What is that, Dr. Gwenn? I don't.
Nutritional yeast, so good.
Yeah.
It's actually really great, especially for people who don't can't eat cheese. It's like kind of a cheesy like flavor. You can get it at any grocery store. It's like usually Bragg's is the company that's the most commonly on the shelf. It's like this yellow powder kind of stuff that it goes really great on popcorn, on vegetables, and a lot of like, vegan cheese sauces are made with it. And you can put it, like I put it on salad sometimes, or just on like, veggies, or
It's like in a powder form.
like a powder form. Yeah, it's almost like a flake / powder. So it looks like in the container, it's just this little Bragg's container with like this yellow powder in it. And it's just in the regular spice section.
The juice and spice section.
Yep, totally. Yep. And that's great stuff. I mean, you can also get it. I think a lot of health food stores will have it in the bulk food section too, because it's something that people, especially vegetarians and vegans, eat a lot of it often. I mean, not all of them, but yeah. It's good stuff though. It's very nutritious. It's got a lot of B6 and B12 in it. I think a lot of it has added B12, but even as itself, it has a lot of B12 in it. It's good stuff. And then magnesium is a really big one. Like I was mentioning about how easy it is to have low magnesium and how many people have low magnesium. Quite a large percentage of people have low magnesium. And the things that always make me sort of like have a little like, red flag about magnesium is if people talk about having muscle tightness, muscle cramps, muscle twitching, especially like twitching in their eyes or in their or just any kind of twitching. And then also if they just talk about, one of my tests is to be like, so, later on in the conversation, so what are your feelings about chocolate? And like people who have magnesium deficiency will be like, chocolate. Other people will be like, yeah, I mean, it's okay, so, and that's not, again, totally across the board, but people who have really strong chocolate cravings, I find that when we supplement with magnesium, a lot of times they end up feeling somewhat indifferent to chocolate. And people don't believe me when I tell them that will happen, but it does. When people are chocoholic like that, usually that means there's a magnesium deficiency there. The high magnesium foods are almonds, pumpkin seeds. Really, all like most nuts and seeds are pretty high in magnesium, but pumpkin seeds are really, really good. Beans and leafy greens. And also those will, taking magnesium it helps a lot with preventing menstrual cramps. I also find it helping with premenstrual anxiety and premenstrual sugar cravings. So magnesium is really good, and it helps with difficulty sleeping. So the magnesium and progesterone both support the same enzyme, which is the COMT enzyme, which breaks down that epinephrine and norepinephrine. And epinephrine and norepinephrine are like adrenaline. They're the things that make us stay awake, thinking about things in a spinning kind of way. And so when we don't have enough progesterone, that makes that enzyme kind of just, not work as well. It sort of gums it up. And so it backs up that level of estrogen and progesterone. And so if we throw magnesium to a situation where that enzyme is a little bit slow and speed it up, now all of a sudden it's basically like you're breaking the dam or opening the dam that's there, preventing the estrogen or the epinephrine and norepinephrine from getting broken down. So it just helps with the anxiety. Yeah. Does that make sense? Or was that okay? Good. I was like, and so yeah, leafy greens are also really high magnesium. Calcium is the other thing that there's been some studies showing that it can help a lot with menstrual symptoms. We do want to make sure if we're using it especially in regards to PMS, we want to give at least as much, if not more, magnesium. So balance it out with the magnesium, partially because calcium slows down that same enzyme that I was just talking about, and magnesium speeds it up. So if we give too much calcium, I've seen it happen where sometimes people have more trouble sleeping and more anxiety. I don't know how widespread that is, but I've seen it a few times. So yeah, it must be pretty, about 10% of the population has a mutation of that enzyme. So they're a little bit more sensitive to things that slow it down or speed it up. So
it's calcium. How, other than drinking milk and cheeses, etc., what other source can you use for calcium?
Yeah, leafy greens are an excellent
leafy greens.
Yeah, a lot of the like broccoli has some calcium in it. But really, leafy greens, if you get a good, amount of greens, and even, when people, and then oats have some calcium in them. What are the other, that is
like Swiss chard and spinach and things like that.
Those are the big sources. Yeah, those are like heavy duty sources. And then And then also too, like if people are buying like nut milks, like almond milk and things like that, if there are people who, not eating dairy, a lot of those they all have high levels of calcium. A lot of it is supplemented. But there is, there's some calcium in nuts and everything. And so when you make the milk out of it, you're getting
Okay.
through there too. Yeah. So and actually what I find is what I always tell people when they kind of think about not getting enough calcium, and there's been kind of this big push, mostly from the dairy industry, to like try to get more calcium, is that, and it's not totally true, like we need to have a lot of calcium, but very often what I find, even people who don't eat dairy, I have them, if we want to see how much calcium they're getting, because there's this sort of these newer studies that are coming out about supplemental calcium, that it might, especially for women, contribute to plaquing of the arteries. We used to be like, here's 1,200 milligrams of calcium, which is a huge dose. And now it's like, oh, maybe we shouldn't be giving quite that big of a dose. What I have people do often is track their food on something like MyFitnessPal, which does like tally all of the micronutrients. That's actually a great sort of thing to do anyway. Just track what you normally eat for a week on MyFitnessPal, and then look at the micronutrient breakdown, and specifically looking at calcium to make sure that you're getting in that like sort of around 1,200 milligrams. And very often people are surprised that they are getting that much. Yeah, even
now MyFitnessPal, is that a free app? Is that a free app, the MyFitnessPal?
Yeah, totally. Yeah. When it's free, you have to like, there's some ads that like are around, but it is free. So that's a good one for, all those micronutrients. And also, vitamin C is also another nutrient that I actually, it's funny because preparing for this class, I've kind of forgotten that. And because I was just sort of like going over a lot of old like notes and things to prepare for this class. And I was like, right, I don't often use vitamin C, but for premenstrual syndrome, but I should. There's some decent research about it supporting progesterone levels, and also especially for people with shorter menstrual cycles. So people who come in and say that they're having a period every 2 weeks, or they're have a 21-day cycle or something like that. Vitamin C, good old vitamin C. It helps progesterone levels. So there's a lot more nutrients that I could list there, but those are kind of the big ones when I think about symptomatic premenstrual syndrome. When we really get down to it, any condition, we could talk about almost every nutrient, how it could be involved in that. But these are kind of the big ones that we see, and both that we see deficiencies contributing to PMS, but also we have studies to show that if we treat with these things, they'll get better. So those are the go-tos there. Some other considerations, there's, seed cycling is something people talk about a lot. Is out on the internet. There's no studies at all to back it up. It's not like something that anybody's ever done a study about. However, I've seen people have really good results with it, and also it's definitely not going to hurt. So what you do when you're seed cycling is you're basically eating seeds at different times of the cycle to support different hormone production. So basically in the beginning part of the cycle, you're eating seeds that support estrogen production. In the end of your cycle, you're eating seeds that support progesterone production. So again, it's like something definitely not going to hurt anybody to get a little bit of extra nuts and seeds in their diet, and also as might really help. It does. There's people who have had major improvements with using it. So the first half of your cycle, the two seeds are flax seeds and pumpkin seeds. I always say either or, but people say do a little bit of both. About 1 to 2 tablespoons of flax seeds and about a 1/4 cup of pumpkin seeds. So that's that kind of, and you can even be fancy and do like, pumpkin seed milk or any of those things. So, and actually there's this new thing called pumfu, which is actually like tofu, but it's made from pumpkin seeds. And I haven't tried it yet, but I had a friend who was just telling me how great it was just yesterday. Yep. Apparently you can get it at Stop and Shop. So, yeah. And then for the second half of the cycle, it's sunflower seeds and sesame seeds. So sunflower seed butter is an easy way to get the sunflower seeds. You can do 1 to 2 tablespoons of that, or eat sunflower seeds is also great. And then you can also do tahini, which is sesame, brown sesame seeds. And that goes great in like sauces and in dressings and things like that. Even like on a sandwich, you can do it. Or you can do ground sesame seeds in any other way. If you do whole sesame seeds, they don't do a whole lot because your body doesn't really break down the shell so well. So that's worth trying. The other thing I really like about that process is that it really kind of like connects people to their cycle. So they kind of like keep track of where they are in their cycle. And I think that that's actually just also its own therapeutic benefit, is just to know, to be like thinking about, like in touch with your cycle. Because then sometimes that, I have a friend actually who plans things according to her cycle, so that like when she's ovulating, she's out like doing talks and things like that. And when she's like the week before her period, she's like, you know, doing writing and like doing work, you know, kind of quiet work. It's pretty cool. But sleep is huge in terms of hormone balance and preventing premenstrual syndrome. It's because of the way that it restores that progesterone level, because you're not trying to steal it to make more cortisol, and also the way that it sort of builds back up that cortisol store so that you don't have to take from progesterone to make cortisol. There have been multiple studies showing that when people get sufficient sleep, that their premenstrual syndrome symptoms improve quite a lot. This gets really tricky because for some people, the symptom of premenstrual syndrome is that they can't sleep, which we can totally work on, and doing things like magnesium and chamomile tea can both be really helpful for that, along with a bunch of other things that I end up bringing in depending on what kind of sleep disturbance people are having. And you know, and really that piece of information is mostly there for people who kind of tend to have delayed bedtime, but they you know, just sort of because they don't feel like they have enough time to get sufficient sleep. It's just sort of another reason why it's worthwhile to get to bed at a good time. Easier said than done, I realize too. And then avoidance of xenoestrogens, we talked about that a little bit, but just sort of avoiding plastic bottles, eating from metal or glass containers. Even watching canned foods actually often have a BPA liner. And so if you look at for BPA canned foods, if you're eating canned foods, and then also to check any skincare products with that environmental working group Skin Deep database to make sure, because there's so many different skincare products that are estrogenic. In terms of like, you know, meats and milk products do seem to be a major source of estrogens. That's a little bit controversial. So, but I think generally people do well with like the, you know, grass-fed milk, organic, because organic means it's not going to be being given any kind of like RBST, and it's also not going to be given like you know, but milk itself is, you know, for making, you know, baby cows get big. And so so it is definitely has, you know, some hormonal activity there. The controversy there is really about whether or not like it makes a difference whether it's organic or grass fed, or whether it's, you know, dairy in general, or whether that's, you know, if that's okay or if that's not okay. All of that, and whether or not hormones are in meats is kind of another thing that ends up being pretty controversial. What I just think about is that, you know, that, you know, always grass-fed and organic is a great way to go. And also, you know, kind of that each of us is a little bit different in how we can tolerate dairy. But really, if people have high estrogen, it's usually a good idea to avoid dairy.
Would it be better instead of getting the commercial brands, of getting like a small, like there's a lot of small dairy farms that sell? Is it better to buy from them, even though they're not quote organic?
Yeah. So, you know, really, yep. There's a couple of reasons for that. There's, again, a lot of what I'm about to say is controversial and not totally 100%, but you know, a lot of them are doing pasteurization, but they're not doing this ultra pasteurization because, you know, I don't know if you've ever if you get milk from the local farm, you know how it goes bad so easily, like so quickly. And that's partly
very quickly, right?
Know? And it's like, and that just is because, you know, this ultra pasteurization is, you know, heating it to a really high temperature so that it stays longer on the shelf. And there's some question about whether that, you know, changes the composition of it, both in terms of the proteins and everything. So I think, you know, buying local, a lot of the local dairy milk that we around here at least is grass-fed too. So like terra firma and everything, good quality grass-fed. Some of the farms are really are organic, but they can't get certified because they one time, you know, there's small farms, they can't afford to lose animals, and so they give antibiotics sometimes if they're sick, you know. But it's really, a lot of those restrictions are there so that people aren't giving antibiotics to make the cows grow bigger, but at the same time it's like, no, actually to run a farm sometimes you have to give an animal medicine. So it gets kind of a little too strict sometimes in certain ways. The avoidance of alcohol is big deal in terms of that alcohol does make premenstrual syndrome worse, worse anxiety, worse mood problems, and worse headaches. And then, you know, reducing or avoiding sugar, especially in the second half of your cycle. One of the things, there's a couple of different things. We talked a little bit about how sugar can make that blood sugar regulation even harder. It also, because it produces this, makes you release more insulin, can increase that water retention, and that kind of just weight gain, breast tenderness kind of piece. And also in terms of the, it can be really hard because people crave sweets a lot when they're premenstrual, but eating things like fruits and high magnesium foods helps a lot, and protein helps a lot with kind of decreasing those cravings. And then exercise always comes down back to exercise. Is many studies have shown improvement in all PMS symptoms with daily exercise, and partially that's because of the way that it affects that hormonal processing, but also because it increases all of the endorphins, so makes everybody feel better. And then I listed some little resources here. There's the Hormone Cure, which is that book I mentioned by Sarah Gottfried. She has a lot of different online programs too. She's great. And there's a link about seed cycling if you want to learn more about how that works and why that works, what the theory is behind it, I should say. And then there's a link to that Mirror fertility tracker that I mentioned, so that you can, if you want to just sort of get like a really clear look at what your hormones are doing throughout the month. Actually, I should totally get one of those for the clinic and like lend it out. Actually, that's a good idea. I need to do that, because then people could use it for a month and then bring it back, and then somebody else gets to use it. Yep. So that's everything. Do you have any other questions or thoughts or concerns? Or
I think you covered them as I asked as we went along. So I think we have it pretty covered.
Oh, great. Thank you so much. It's good to see you.
It's good to see you too. Have a great rest of your day.
You too. I hope it's nice and cool.